My name is Edebiro Bemudia, your doctor of cardiovascular physiologist. Today, I'll be putting us through on ECG interpretation. From where we stopped the last time, I'll continue from there. So today, we'll be dealing with ST segments. So, let me draw the ECG representation, then I will indicate the part that is the ST segments. This is the ECG graph. So, from here to here, represent ST segments. So, the first isoelectric line is the P arrow segments. This is the first isoelectric line, and this is the second isoelectric line. In a normal ECG representation, this second isoelectric line, which is equally called the J junction, you can see J, like something like this. We'll call it the J junction. The J junction, this. So I decided to bring this out from here, from this X to T. That is the onset of ventricular repolarization. That is, the ventricle is at rest, is resting, repolarization. So, and the end of ventricular depolarization and the onset of ventricular repolarization, that represents the ST segment. In the normal ECG morphology, the ST segment is isoelectric. When I say isoelectric, it is straight line. That is a straight line like this. A straight line. A straight line, you can see from here to here is the ST segment. But in a pathological condition, so I will now show you, in some cases, the ST segment, when it's elevated or when it's depressed, that is not normal ST segment. So we'll now look into that. I will remove this. I'll remove this and draw another ST segment that is elevated. You can see the S. So from here to here, this S, this T. ST segment elevation. You can see the ST segment is elevated as compared to this. See a normal ST segment that is not elevated. This is a normal ST segment. This is S and this is T segments. This is normal ST segments and this is abnormal ST segments. This very one is ST segments elevation. So the ST segment is elevated. ST segment can be elevated in ischemic heart disease. In ischemic heart disease, when an individual is presenting with ischemia, so the ST segment can get elevated. Equally, when an individual is presenting with hyperkalemia, that means increase in the level of potassium, the ST segment can equally what? Be elevated. But most especially, ST segment is elevated in a condition when an individual is presenting with ischemic heart disease. That will now take us to another diagram when ST segment is depressed. This is it. You can see this is S and this is T, segment depression. So if you look at this is normal ST segment. ST segment, normal. It's isoelectric, it's a straight line. But if you look at this very one, this is Q, this is P, this is Q, this is arrow, this is S, and this is T. You can see the ST is depressed, like a lake. Is depressed. So pathological condition where ST segment can be depressed is MI. That is myocardial infarction. When an individual is presenting with myocardial infarction, ST segment will be depressed. And at the same time, when an individual is presenting with ventricular strain pattern, the ST segment will be depressed. So that is it. And that will now take us to, you can see the difference between a normal ST segment and ST segment that is elevated and ST segment that is depressed. When it's depressed, it's like this. When it's elevated, it's like this. This is elevation. This is depression. This is depression. And this is normal. This is normal. This is normal. When it's normal, it's straight line. When it's elevated, you can see it elevated. Then when it's depressed, it's going down. Depression, elevation, normal morphology. So that is ST segment. So if you have any question that is bordering on ST segment in terms of interpretation of ECG, you can always write me up in the comment section. Try and subscribe to my YouTube channel. Like it and comment. Thanks for always engaging in my YouTube channel. Thanks for watching. I remain your humble host. Edebiro Bemundia Endurance is my name. Your doctor of cardiovascular physiologist.